A Sports Center top 10 type catch cost Yankees utility guy Jasson Domínguez at least what the team is calling a few weeks after an MRI revealed a low-grade sprain of his left AC joint. So in today's injury report, we're talking with Dr. Dennis Cardone, Sports Orthopedic Surgeon at NYU Langone, to see when Jasson's shoulder will be ready to get back to the action and if it could actually affect him as a switch hitter at the plate. Doc, thanks for hopping on with us today. You know, when they go on IL, we talk about them on IR. So here's the video of the catch and the collision. Great catch, as you can see here, but you can see him kind of take that blow to the head and the shoulder. The concussion test came back negative, which is a good thing, but he does have that low-grade sprain in his left AC joint. So a low-grade sprain means what? And he'll miss a couple of weeks, but could have that been a lot worse?
So the AC joint, a little small joint on top of the shoulder, and it's held together by ligaments. So we grade those injuries according to the degree of injury to the ligament. So a low-grade sprain would mean that there could be some partial tearing of the ligament, not a complete tear. The joint is in a good position. And it's almost in this scenario more about symptoms will probably be the guide. As he's feeling better, they could absolutely start to progress his activity. It's a painful injury. So things like throwing, batting, just moving is very uncomfortable, especially early on. So again, here, healing's going to be fine. That's not the issue. It's just about what he can tolerate in pain.
Okay, it's all about pain tolerance. And we're talking about a guy whose superpower is that he's a switch hitter. He bats both left and right, but he throws with his right hand. So I guess that shouldn't affect his throwing that much with the injury since it's the left AC joint. But how is it going to affect him at the plate? And what's his rehab going to be like to get him back in full swing? No pun intended.
So at the plate, left shoulder, batting left-handed is going to be more difficult for him because as that arm goes across the body to follow through, it's going to be uncomfortable for him. So batting left-handed, definitely more painful, probably will take more time before he'll feel comfortable batting in that position. Like you said, throwing shouldn't be much of a problem for him. The rehab is pretty straightforward, just some strengthening. But it's more about time than even rehab for this type of injury, an AC joint injury.
Does he have to wear any sort of protective covering? Is there a brace? Or is he good to just go out the way he naturally is?
Good to go out and play. We usually do not brace these, not necessary. It's one of the few rare instances in sports medicine where we sometimes will even inject these prior to a game because they're not risking injury to that small joint. So it really depends. Everything symptom guided, pain guided.
Okay, like you said, it's all about the pain tolerance. I remember I did this while I was getting ready for my pro day testing, and I couldn't do 225 just because I wasn't able to kind of bench press at all. And I'm catching passes at a Boston College pro day, and you just felt it the entire time. And it's not like I can be like I'm gonna stop and be like, sorry guys, my AC joint is kind of flaring up again. But it is something that, as I've experienced, he's going to have to deal with, that wincing pain from time to time. But at the end of the day, it's a guy that's going to try and make the best out of all of his opportunities out there. So let's say a patient comes into your office with a sprain in the AC joint. Would you treat them the same or a little bit differently than the Yankees are treating Jasson Domínguez?
I'll tell you, one of these injuries where the treatment is the same, right, for your weekend warrior or your professional athlete. Once again, just like you said, it's all about the pain. And as soon as that athlete at any level can start to tolerate the activity, we typically let them go return back to play, let them get out there. And especially if it's a mild grade sprain, the more severe ones then there's a difference about how we treat them. In the most severe form, there's even surgery. But in this scenario, this is just about time and getting rid of those pain symptoms.
Would you inject one of your patients as well?
If I had a high level athlete and a really important game, we would consider injection because it is safe. Of course, the most important thing is the safety of the athlete. but this would be one scenario where we would consider an injection prior to a game that would really help quiet down pain and symptoms.
All right, Doc, appreciate your time today.
Always a pleasure to see you. Thank you so much.